So I want him as close to me as possible, and I'm going to tell him to relax, arm bent, make sure he's relaxed. Some people like to put their arm here. I want the clavicle, I want the shoulder to be as comfortable and loose as possible. I'm going to grab on to the inferior border of the scapula, just like this is going to be. I'm going to wedge it. All right, so for medial and lateral gliding, and this would be used for like when the patient's coming out of surgery, or has pain, has been using the arm biomechanically the way it should be used. Everything gets kind of tight, bogged down, whether by pain, so muscle guarding, or even inflammation around that whole false joint. The scapulothoracic joint is going. You want to start moving it now to get those mechanics the way they should be, responding or acting, right? So with this, come a little closer. So I always tell them you're not going to fall off from right here. You're going to go relax your arm. You're a little too tense. Good. So from here, there's no grading with the scapular either. It's just going, and I'm always going to check in with the patient because right now I really can't see him, but I'll say, how's it feel?
Okay.
All right. So again, I'm just grabbing on. I'm not going underneath here. I'm just going back and forth. So I'm just going again medially or retracting. And I'm stabilizing here. This is just going along for the ride. Okay? And the other way, and everything is coming through my eminence, my thenar eminence, my thumb. Okay? And the other way, now my fingers are going to have to do the job a little bit. Relax. I know when they get tightened up, so when you have to sometimes like oscillate them a little bit, tell them to relax, and then lateral glide from here. I'm a little bit underneath his scapula too. Sometimes you may not get any of that, so it might be like just back and forth like this. And you want to rock your body. You're not using just your shoulder or your arm, okay? You all right so far?
Yeah.
So that's medial lateral. And then the other way up and down, so superior inferior glide is going to be underneath, just lifting up. Again, relax please. There you go. So now I got more of a glide out of him that time. And I'm going to go all the way down, push. This is going to assist me a little. You could do back and forth, or you could just stick to one side first. You could just do 10 like this. Superior glide. And again, my body is weight shifting. And then posterior, or inferior, sorry. Relax as best as possible. You're all right?
Yep.
And the other way is going to be the tilting. So anterior, posterior tilt. Grab on. Just help me a little bit, but mostly I'm doing the work with this hand. And again, I'm rotating my body. You okay?
Yep.
And the other way, posterior tilt, medial tilt. Just like this. And again, it's coming from the eminence of my hand. Okay? And then the other way, distraction, so what I'm going to do is come towards me. I'll press my body on him a little bit. I'll come retract. I'll get my hands underneath and I'll pull up and forward. So I'm getting fully, I'm trying to curl my hands underneath to the front portion. Okay? Curl underneath, come up and forward. Just like this. Lift off and come forward. That painful? Yeah. Some people could be painful, very tender, so just gauge how far underneath you should go. Some people get really underneath, which is great, because then you can really mobilize, and some people you can't get anything, it's so flat. So you'll see once you start working on each other, who's a lot easier to mobilize like this and who's a little is a little tough. The other way you can do it too is you can stay behind them, and so come towards me. Again, I don't want to lean, I want to do less work as possible. So then from here, I could just do the movements I want. The same way, just staying behind them. Okay, so up and down, so forward and back, tilt forward, tilt back, superior, inferior.
So your left hand is still just stabilizing?
Yes, it's helping me a little bit, but I'm doing more of the work on the hand that's on the actual scapular area. Okay, and you notice I'm not just muscling it, I'm using my body to make it easy for me. Relax as best as you can, relax. Okay, and I'm always checking in with the patient because I can't see him right now. I don't know how he is and how he feels. You all right?
Yeah.
Okay. Anything else to add from Dr. Page?